Hi, everyone, and welcome. We are getting started right now. Just a couple of quick reminders for you. Please share your questions and comments with us in the chat box. We'd be happy to answer any questions you have today if you're watching the live webcast. We are going to have a very brief feedback post-assessment following the live webcast, so we'll have a couple of minutes carved out for you to participate in that. And we highly encourage you to browse our website along with us today. So on the screen right now is the link to that website. It is lung.org/cessation TA. So if you're somewhere cozy and comfortable where you're able to safely access our website alongside us, please do so. We welcome that. And this webinar is made possible through a cooperative agreement with the Centers for Disease Control and Prevention. The views expressed today within this webinar do not necessarily reflect those of the CDC. And really quickly, I just want to go over a couple of important definitions and key terms that we'll be using today. All references to tobacco and tobacco products within this presentation refer to commercial tobacco and nicotine products and not the tobacco and other plant mixtures grown or harvested and used by Indigenous people for sacred purposes. So welcome to Furthering Health Systems Change in Your State Isn't Hard When You've Got Your library card. Everything you need for a better future and success has already been written. And guess what? All you have to do is go to the library. The famous Swiss philosopher Henri Frederick Emile said that quite some time ago. And I'm honored to be your virtual librarian today and take you on a tour of the American Lung Association's online cessation technical assistance library. My name is Rebecca Padilla, and I'm the Senior Manager for Nationwide Tobacco Programs at the American Lung Association. And I'm joined on the webcast today by my teammate, Eva Book, Senior Manager for Nationwide Tobacco Programs.
Really quick, Rebecca, I saw Debbie put in the chat that we aren't seeing anything on the screen besides participants. Could someone else let us know if that's the case for you as well, really quick? If so, I can go ahead and share my screen in case that makes a difference. I can see your screen.
Yes, I can see the welcome screen. Great. So you should be able, hopefully you can see the screen of our other teammates that are not joining us today. So Eva and I are part of a larger team here at the Lung Association who can provide training and technical assistance for cessation and health systems change to folks all across the nation. And our team has truly been dedicated to providing support for state tobacco control programs, health systems, and community partners to support their work to improve tobacco cessation efforts, from implementing health systems changes that enhance electronic health records to exploring emerging issues that may impact cessation. And we're proud to report that at this point in our work, we have worked with folks from all across the country, from coast to coast, including all the way from Hawaii to Alaska to DC, and 3 of the 5 US territories as well. And of course, no trip to the library would be complete without a little history lesson, right? Although our team has a history over the last few years of providing some great technical assistance, our organization is proud to be celebrating 120 years of saving lives by improving lung health and preventing lung disease. Since 1904, our organization has remained steadfast in its mission, and as long as anyone struggles to breathe freely, our association will be there to champion for healthy lungs. The American Lung Association pioneered the model of education, advocacy, and research to address public health issues. The American Lung Association was among the first to make the connection between air pollution and lung health, advocating for clean air, including important work like eliminating smoking on domestic flights. We championed the passing of the Tobacco Control Act, and we helped achieve increasing the age of sale for all commercial tobacco products to age 21. Our work today continues as commercial tobacco use remains the leading preventable cause of death in the US. And we know that the toll of commercial tobacco use remains devastating. However, the majority of folks that use tobacco products want to quit. We have some challenges to address in our work, though. Uh, 50, a little over 50% of adults who saw a healthcare provider and who smoke received advice from that healthcare provider to quit. And of those who saw a healthcare provider, uh, again, about 50% received assistance to quit. So what that means is they received perhaps a referral to a quit line, or received information on quitting, or received counseling or quit medication. And of those, again, that saw a healthcare provider, 38.3% of those adults who tried to quit used an evidence-based treatment. So that might be counseling or one of the 7 FDA-approved quit medications. So of all those folks, there's still over half of people that we have that can really benefit from interventions within a healthcare system. So that's really what I'm here to talk to you about today. And Eva's going to help me explore some of the great resources that we have tucked away in our library. So smoking cessation is arguably one of the most powerful, cost-effective interventions available in clinical settings for the prevention of disease, disability, and death. But despite these known benefits, the systematic integration of evidence-based tobacco treatment interventions in hospitals and clinics still isn't viewed as a standard of care. So even though we know that just over 50% of adults are receiving advice to quit, we know that there's lots of room for improvement. So for healthcare providers, there's a duty to treat each patient with the highest level of care available. But if nicotine cessation isn't promoted, that's just not living up to that standard of care. So clinicians and care teams in various settings play a really critical role in delivering that important care and in delivering cessation support. And the burden that tobacco use plays on health systems is significant. We know that. And addressing it at all levels needs to be a consistent priority. And we know that smoking cessation reduces the risk of death, it improves recovery on all levels, and it reduces the risk of hospital readmission. So the Centers for Disease Prevention, the CDC Office on Smoking and Health, we'll abbreviate that to CDC OSH, supports state-level national tobacco control programs, or NTCPs, to implement comprehensive tobacco control program efforts. And that includes initiatives aimed at increasing smoking cessation through health systems change efforts. So how do they do this? So these national tobacco control programs encourage the development and enforcement of tobacco use policies in healthcare settings. So these state programs provide specific training for healthcare providers on delivering effective tobacco cessation interventions. They also promote and support cessation efforts among patients and healthcare staff who use tobacco products. And in 2019, our team here at the Lung Association was awarded funding through a cooperative agreement with CDC OSH to provide training and technical assistance to those state tobacco control programs to help increase cessation through health systems change strategies. And since that time, our team has provided expert technical assistance in a variety of modalities to meet the needs of tobacco control program staff around the country in the modes that work best for them. So whether they're seeking on-demand resources or opportunities for peer-to-peer connections, we've been there to meet their needs. And whether those needs are direct one-to-one technical assistance to address really comprehensive um, technical needs, or whether they're wanting, more interactive sessions with peers, we've had the opportunity to really connect with folks from around the nation. And we've been able to do this through various different modalities, as I mentioned, and we've been able to tailor our technical assistance to really be responsive to what we're seeing in trends across the nation. And we've received really great feedback from the folks that we work with. And we've done this through various means. And, most of the folks we work with have really appreciated our open door approach over the years. And that's something we're going to talk about as well, is how we've developed some of the great resources we'll be sharing with you. So everything we'll be sharing with you today has been informed by those experts in the field that we work with on a daily basis. So oftentimes, what happens is we'll get a request here at the Lung Association for some direct one-to-one assistance. And sometimes that assistance will lead to a bigger discussion in one of our cohort groups. So cohort groups are really focused peer groups that will meet on a specific topic several times over the course of a few weeks, maybe even a few months. We've held cohort groups usually a couple of times a year for the last 5 years. So these cohort groups have ranged on topics from behavioral health to youth interventions to the opt-out or proactive referral model of treatment to enhancing referral processes and a few others that aren't coming to mind at the moment, but they are always the highlight of our work here at the Lung Association, and they're really fun. And these have led to some great discussions and peer-to-peer connections as well. And from those cohort groups, what our team does is we take those peer-to-peer connections, our learning and our findings from these cohort groups, and then we synthesize all of those resources and those findings and that experiential knowledge, and we pour them all together into our public health roadmaps, our toolkits, and more, and share them at large on a national platform like we're doing right now. So everything that we produce here at the Lung Association has kind of been road tested and kind of put through the ringer, if you will, in health systems all across the nation, and has been proven to be um, tools and proven to be strategies that really work with other tobacco control programs, with other health systems, and in other communities across the nation. So we are hopeful that by collecting them all together, that there'll be a collection of resources that will stand the test of time and can be used for quite some time moving forward. So our team has really respected the position that we've held for so long here, and being those trusted experts. And we're proud again to report that at this point in time in our work, we've worked with all 50 states, DC, and 3 of the 5 US territories in our technical assistance project here. And we've responded to 100% of our TA requests for technical assistance. And what we're going to do today is we're going to share some of our most used resources. So we wanted to highlight a few of the best and brightest from our resource collection with you. And with that, again, if you're in a spot where you can follow along with us, we would love for you to follow along with us. We're going to be sharing some highlights from our toolkits, from our roadmaps, from our resource library, and Eva is going to share our website. So you can scan the QR code if you're following along on your phone with us, or if you have an extra laptop around, you can log into lung.org/cessation TA. Otherwise, Eva, do you want to go ahead and get us going on that tour of the resource library? Awesome. And Eva, it looks like you've got us on our homepage at lung.org.
Perfect. All right. So I'm hoping all of you can see the screen that I'm sharing, which, as Rebecca mentioned, is lung.org. And so to get to our lung.org/cessation TA site, what we're going to do is go to advocacy policy under tobacco cessation. From here, we'll scroll down just a bit and find tobacco cessation technical assistance. And so that's one way to get to our page. Another way is simply typing in lung.org. As you can see, I type it in a lot, /cessation TA. And that'll take you right to our page.
Awesome. Thanks, Eva. So as you can see here on our page, it's our resource hub for effective tobacco cessation. So we have a few different primary boxes here. So as I mentioned, our resource library, we're going to save that for last. That's kind of the highlight that we want to show you. The first thing we see here is our webcast. So we have a great resource collection of webcasts, and all of these are available on demand for you. So we have everything from Medicaid cessation coverage to lots of different, our opt-out model, unwinding the unwinding. There's everything from health systems change to coverage and, you know, more clinical cessation treatment topics are covered here as well. How to partner with your state insurance commissioner. Excellent 101, 201, 301, and then some webcasts can be found here. Most of these are around 45 to 60 minutes long, and they're all on demand. So let's say you only have a few minutes. You can digest these in little bits and pieces and use them as you need them. And yeah, lots of great ones here. If you look off to the left-hand side under webcasts, you'll see we have our opt-out model. This is a recording of, or actually this is kind of a synthesis summary of our cohort. And it's got key presentations from one of our most popular cohorts that we had. I think we had almost 100 participants in this cohort. It was really a great one. If you haven't heard of the opt-out model for treatment, I highly suggest you check this out. Really interesting stuff. It's also known as proactive referral to treatment. It is basically the standard of care for every other chronic disease except for nicotine dependency. So you can learn why and how it works right here at the opt-out model for treatment. And you'll also see that there's a tobacco cessation coverage 101. That's a great place to get started if you're newer in a tobacco control program, or if you're newer to the world of health systems change or tobacco treatment. It's a great primer that our sibling team in coverage rolled out last year. Fantastic primer there. So moving back to our landing page. We also have wonderful podcasts that are a great complement to our webcasts as well, mostly focusing on coverage topics. So let's go to our toolkits. So we have some great toolkits here. We have our Sisters Toolkit, our Community Benefit Toolkit. We also have our Public Health Roadmap. So this is a really wonderful section here that I would love to talk a little bit more about. So our integrating tobacco use in disordered treatment in behavioral health settings toolkit is one of the most comprehensive toolkits that I've ever had the opportunity to work on. Even I and our teammates spent an enormous amount of time and energy and effort working on this. And I am so proud to highlight this today. There is everything you could possibly need if you are beginning to work in behavioral health settings, or in any setting to integrate a cessation intervention. We have a self-scoring integration assessment tool here that is primarily focused on behavioral health settings. However, it's really applicable in any setting. I suggest you play around with it. Feel free to take it, share it with your colleagues, take a look at it. It's great, and it self-scores and points you in the direction of other resources that we have and how you might be able to use those. There is academic detailing resources in this toolkit. There is, culture change strategies in this toolkit. There are embedded webcasts in this toolkit, information on documentation and billing. Really, anything you could possibly need and then some is in this toolkit. And it was all created with amazing partners in the field, including Dr. Chad Morris from UC Anschutz in Colorado, amazing expert there, as well as our friends in NAMI, Kansas, that we have worked with, who helped us with the integration assessment. So lots of great work there that we're really, really proud of. We made this a few years ago, but it is incredibly relevant today. So please take a look at it and let us know what you think. So if we go back a little bit to our landing page again. Awesome. And go to the public health roadmaps. So we have several different roadmaps here. So the very first one that was created in 2020. So it didn't get the attention it deserved in 2020 because there was a few other things going on in 2020. We're not going to talk about that. But this was really built to be a companion to the Million Hearts Tobacco Cessation Change Package. I would love to know in the chat box if folks out there are familiar with the Tobacco Cessation Change Package from the Million Hearts team. It is fantastic. It is the best tool available for clinical teams. Yay, someone said absolutely. Awesome. So I said clinical teams. It was made for clinical teams. This is made for public health folks. So this is made for a public health team who might be working with a clinical team. So this is a companion guide to go alongside that clinical package from Million Hearts. So this is a condensed little primer that will tell you where to go to get you started in that big compendium of the tobacco cessation change package. So that's that top one. And that'll get you going on how to use the tobacco cessation change package. So let's say you are a brand new cessation specialist at a tobacco control program, and you've been tasked with going out and talking to a health system partner about integrating cessation interventions, and you're a little overwhelmed. This is a great place to start. I highly suggest you bookmark these and just save them in your bookmarks folder and go back to them when you need them. This is not a good tool to print up. I mean, it's beautiful, you can print it, but it's so much more effective to bookmark it and use it as a digital resource, because all of those pretty turquoise phrases and titles that are, highlighted in turquoise are clickable links that will take you to other resources. Just like the tobacco cessation change package is a virtual tool to be clicked and not to be printed. So it's meant to be used side by side. So if you can take us back to the roadmaps again, Eva, thank you so much. So that was so good, but we needed to do a little update with even more goodies. So we rolled out a second public health roadmap in 2021 that has a few other key strategies and resources highlighted. Again, it's a companion to the 2020 public health roadmap. So has a few other comprehensive resources added to it, a few lung resources that were added as well. And also, again, bookmark it, save it for when you need it, click it, don't print it. And if you scroll down a little bit more, we have our public health roadmap for behavioral health settings. So this is the condensed version of that giant toolkit that Eva just gave us a walkthrough tour of, as well as some key fundamentals of what you need to know as a public health professional going into a behavioral health setting. So something really interesting that our team learned when we were working on this project is that there's a whole new language that we had to learn with behavioral health. So this kind of breaks that down for other public health folks that are, beginning to work with professionals in behavioral health settings, whether it's inpatient, outpatient, or hybrid organizations that offer both. This is a really great specialized toolkit. Again, it points you back to those great resources that are in the TCCP. So again, pointing you back to those clinical resources that we know are tried, true, and tested to work. So thank you. And then finally, we have our public health roadmap for systems change strategies to address youth cessation. So this is a really great one that builds upon the clinical considerations package that our friends at the American Academy of Pediatrics rolled out a couple of years ago. So again, this is clinical considerations and not full, guidance for pediatricians, but something of important note that we need to be sure that we're well versed on and talking about for folks that are serving youth and working in pediatric settings. So this is a great youth specific public health roadmap that points to youth specific strategies and interventions and tools that would be applicable for those settings. So definitely, again, with all of these, bookmark them, save them for when you need them. And again, click, don't print. Awesome. Thanks, Eva. So if we go back to our landing page, right. So we have another little box here on our listserv. Eva, do you want to tell us a little bit about that listserv before we move on to the resource library?
Yeah, definitely. So while our cooperative agreement with the CDC will be ending at the end of this month, being September of 2024, we here at the American Lung Association are still dedicated to supporting you and our nation and providing resources and tools to support integration of tobacco cessation services into state health systems. One of the Lung Association's 4 strategic imperatives is to create a tobacco-free future, and we've been working on this goal and will continue to work on this goal through the development of educational resources and providing support and technical assistance. With this, all of the resources that we've developed and collaborated on that Rebecca has mentioned so far and that she will continue to mention will be available following use in September. As long as they're available and applicable, we'll still provide those to anyone who needs them. I also just got word today that our cessation TA listserv, as well as our cessation TA at lung.org email, will continue to be available after the end of this month and until further notice. So with that, if you ever have any questions regarding the Lung Association resources or would like to connect with our team, we absolutely welcome you to do so. You're welcome to reach out to us directly or reach out to us through our cessation TA at lung.org email. And
Awesome. Thank you so much, Eva. We love that. And that's something we've always been very, very proud of here at the Lung Association is there's no wrong door to get a hold of our team. So if you have a question, please reach out to us. You'll get myself, Eva, or one of our other teammates, and we're always happy to steer you in the direction wherever you need to go. So finally, let's take a look at our very, very big resource library. We saved the best for last. So our resource library has not just resources from our team and our other teams here at the American Lung Association, but this has resources from our trusted partners from across the nation. So this has resources from, national partners and lots of topics here. So Eva can just scroll and scroll and scroll and scroll. So we have different types of resources here, different topics. If it has to do with cessation, it's in here and it's updated all the time. So as you can see here, by the type of resources that we have infographics, we have fact sheets, we have guides, handouts, manuals, policies, posters, presentations, even slide decks, surveys, toolkits, you name it, we've got it. If it's not in there, it will probably be in there next week. So again, bookmark this particular page in your bookmarks folder and go back to it when you need it. One of the things we've tried to do is make this as user-friendly as possible. So if you can see up here, there's a few different ways that you can search our resource library. You can search by topic. So we tried to do a few key topic areas within the field of cessation. So we have a drop-down list here of some key topics that as a team, we collectively tried to brainstorm some key topics within cessation. So as you can see here, there's basics, there's behavioral health, health equity, menthol, pregnancy, private insurance, quality improvement, systems change, telehealth, tobacco surcharges, return on investment, youth. There's so many things here. So let's say, you want to look at return on investment. You're walking into that health system. You're trying to make the case to leadership on why they need to integrate a cessation intervention. Here's some great resources for you on how you can help build that case on return on investment. Another way that you can search is by keyword. So this can be a little bit trickier. It's not always the easiest, but you can search by keyword here. You can, let's try, Eva, do you want to, let's see, toolkit, sure. Let's see what kind of toolkits we have. So there's several different toolkits here. There is the Tobacco Health Systems Change Starter Toolkit for clinics. This is a great one from our partners at Clearway, Minnesota. So we have all of the collection of Clearway, Minnesota on our resource library here. They were kind enough to gift us with all of their amazing resources a few years ago. So we were trusted to store those for them, and they will be here archived forever for everyone to use and benefit from. So if you go back and search Clearway, Minnesota, Clearway, all one word, you can access all of their amazing resources as well. Yep, awesome. And there should be more on there, but we'll make sure that they're all popping. Great. And yeah, so there's tons of great resources here. You can also look by published date. So if you're wanting something, more historical or something newer, you can check by that as well. And then we try to do our best to kind of cite these by author as well. So anything you could possibly need is here. If you find a great resource that's not listed in our resource library and you would like to see it listed, if you're one of those partners that's watching and you want your resource listed in our resource library, you can reach out to us at cessationta@lung.org and let us know that you would like to have your work listed in our resource library. We're always happy to collaborate and share great information with others. So please don't hesitate to share that with us. We're always happy to, consider other great resources to be included in our library. So yeah, if there's any questions today, please feel free to pop those into our chat. Eva, did I leave anything out today?
Something I'm personally a big fan of is our lung.org/empower your community webpage. I think that's a really neat just site that we were able to develop, not necessarily through the cooperative agreement, but something that our team finds incredibly valuable. So I'm going to go ahead and go to that page now. And actually, it was under Toolkit.
Yeah, I saw it. Yeah.
That's what reminded me of it, actually. But so lung.org/empower your community is the go-to spot for all of our toolkits. And so I'm going to go ahead and pop that in the chat. But as you can see on screen, we have the Addressing Tobacco Use in Black Communities toolkit, Addressing Tobacco Use in Hispanic or Latino communities, which we also have available in Spanish, and then Addressing Commercial Tobacco Use in Indigenous communities as well. And so we have webcasts that go alongside these toolkits. And so please feel free to take a second and to go through them. We use trusted partners, and these have been reviewed over and over again. We're so happy that we have these and are going to continue to grow off them as well within the organization. So that was the last thing I wanted to note and share.
No, we love that. That's really important to address as well. Anytime we're doing health systems change work, being sure that we're doing everything we can to help advance health equity is so critical, so important. So thank you for pointing that out, Eva. So we do have, plenty of time left. So if you have any questions at all, feel free to pop those in the chat, or again, you can reach out to us anytime via email. And we do have a very brief feedback form for you today. So we would always love to get your insight and your takeaways and find out how we can continue to serve you and support you. So Eva, if you could share your link for that feedback form, I'd appreciate it.
Awesome. It's all in the chat, as is simple links to the Cessation TA email and your and my email specifically, Rebecca.
Wonderful. Thank you. Right. So with that, I think, we have our resource library. We hope everyone will visit it. Please feel free to send us an email, say hello, let us know how you like our library, our resources, and we're always happy to support your work. And with that, we'll let you all have a wonderful afternoon.
Thanks, everybody.